Hi and welcome to the lecture Causes of Disharmony. My name is James O'Sullivan. Today we're going to be talking about heat and the nature of heat. Conditions that are described as hot and inflammatory. They're usually made worse by hot conditions or hot environments or hot weather, or when our patient is exposed to direct heat. They represent an overactive metabolic process, which can result in hypertension, hyperthyroidism, ulcers, as well as flu, skin rashes, colitis, and inflamed arthritic joints would also be representations of heat. Um, the main clinical manifestations of heat would be a feeling of heat, cracked lips, sore throat. The throat would be hot. In fact, this is one of the classic symptoms of invasion of wind heat. The person would be very thirsty, and also there would be foul smelling stools or diarrhea and a scanty urination. There may also be constipation as well. The tongue would be dry, would have cracks, and the pulse is rapid. Fire, as I mentioned in class, is an extreme form of heat. We're going to look at the two of these together as we move through this particular year. If you move on to advanced study in traditional Chinese medicine, we'll be looking at those two as distinct. Fire and heat move upwards towards the head, and they're expansive. They're outward moving. Fire damages the blood. It makes it run reckless. It's very yang in nature, and it causes hemorrhages, for instance. Fire also disturbs the shen, or disturbs the mind, and may cause manic symptoms. The nature of fire is like heat to rise up into the head. It dries and damages, injures fluid. It injures yin also, and it depletes qi, and it affects the mind directly. Excess fire, when we look at the main clinical manifestations, there's a pronounced fever. The person craves coldness. They have a flushed complexion, bitter taste in the mouth, and thirst, severe headaches, mouth ulcers, bleeding gums, red eyes, scanty dark urination, again constipation or foul smelling diarrhea, bleeding, insomnia, anxiety, mental agitation, and manic behavior. So you can see from this clinical picture that this is a full pattern. Then the tongue would be red with a yellow coat, and of course the pulse is full and rapid. Another fire pattern that we may come across, and we may not call it deficiency fire in class, we might call it deficiency heat or empty heat, and the main clinical manifestations of this would be night sweating, feelings of heat in the chest, palms and soles, known as five palm heat, heat in the five centers. There would be red cheeks or malar flush, dry mouth, afternoon fever, and the tongue would be red and peeled, or it may have a geographic coat, and the pulse would be rapid and would be a floating and empty. Next pathogenic factor we need to look at would be dampness, and this is often associated with a damp climate, damp environment. Could be wearing wet clothes. It tends to be clammy and viscous and persistent, and it's difficult to treat, very difficult to resolve. Patients may also reside where the ground drainage is poor, and it can have dry skin on top of it and damp below, and we'll look at that later on. When we look at the main clinical manifestations of dampness, we see that there's a feeling of heaviness, cumbersome limbs, aching joints. The patient may also complain about being fatigued and tired. They may have difficulty in bending and stretching, and digestive disturbances. There may be loss of appetite, and they may also suffer from nausea and abdominal distension. The tongue is usually with a greasy coating, and again dampness can combine with cold or with heat, and the pulse is slippery. These would be the classic tongue and pulse of damp conditions. As I was saying, dampness can also combine with heat, and it usually affects the upper jaw. It affects the face and chest, whereas damp heat affecting the middle jaw affects the spleen and liver. It also can affect the lower jaw, affecting the intestines, the bladder and the genitalia as well. The next pathogenic factor we're going to take a look at is dryness, and it's usually associated with the lungs, autumn, and the metal element in the 5 elements theory. It comes with wind from outside, or it can also be internal Jinye or body fluid deficiency, which has been damaged or injured by heat. It's a yang pathogenic factor, and it tends to injure blood and yin. And it's exterior in origin. However, it's not yin deficiency. It's not interior. Dryness also tends to damage body fluids, and the main clinical symptoms and signs of dampness would be dry skin, dry hair, dry eyes, dry lips, dry throat, low-grade sore throat, dry stool, scanty urination, and thirst. And as I said earlier on, it easily damages the lungs, and it could be from dry climate or smoking. Modern day living with central heating and no air circulating within the house with closed windows, double glazing, and that can be a sign or can be a cause of dryness. Dry cough, dry phlegm. This is a thick, sticky, hard to expel type of phlegm. The main clinical manifestations of dryness would be dryness, dry nose, dry mouth, dry skin. Often we can have nosebleeds as well, but not gushing. Cracked lips, tickly, sore throat, and thirsty. And again, we can have one or more of these symptoms. We don't necessarily have to have all of these. This is a classic clinical manifestations for dryness. There may be dry stools in there as well. Scanty urination would be other clinical manifestations. And the tongue would be dry. It would have cracks and mirrored. This would be red and shiny. Or it may be peeled as well, and the pulse would be rapid. Summer heat is a pathogenic factor that exists in its own season, and the main clinical manifestations would be aversion to cold, sweating, constipation, scanty yellow urine, or it may be dark urine as well, dry lips, thirst. There's a high fever with summer heat, thirst with a strong desire to drink, and the patient may suffer from dizziness, telling us that again this summer heat rises up and affects the head. There may be restlessness as a result, blurred vision, headache, and agitation. And when we look at summer heat, in severe cases, heat can invade the pericardium and cause clouding of the mind. And this manifests as delirium, slurred speech, and sometimes unconsciousness. The tongue would be red and thin, and the pulse would be rapid and surging. That concludes our lecture on heat. I hope you enjoyed it, and again, you need to be in class to get the extra notes on these particular pathogenic factors. So until next time, Sláinte.